Thank you, Joe. Dr. Ben Carson is still with me. I want to get your take on this disease. New reports every day of more people, Dr. Carson, becoming infected, and still any real cure, according to the FDA, is still years away. What are your thoughts on the situation so far?
Well, you know, we have some excellent researchers and medical minds, and I'm sure we will come up with a vaccine. However, I, as you know, was not enthusiastic about introducing this disease in our country, even in contained facilities, because the people, Dr. Brantley and the nurse, were well trained in this disease. They had all the protection that was thought necessary, and yet they still contracted the disease. There's always human error. So why subject ourselves to the possibility of a spread from them when we don't have to, when we have the ability to treat them elsewhere and then bring them back home? I'm still waiting for an explanation as to why we would take that risk, and I haven't heard a satisfactory one yet.
And as we know, President Obama supported bringing these two Americans back to the United States. And Dr. Carson, it's just fascinating to hear a doctor of your status, a former neurosurgeon, say this, when we all assume that the doctors willing to take this on in the United States are assuring everyone that this is a contained environment. They know how to handle it, and they know how to contain it. But you are saying otherwise, that there is reason to fear that this virus could be spread outside of the hospital.
Well, you know, in medicine, we do something called a benefit to risk ratio. And when the risks are greater than the benefits, you don't do it. It's as simple as that. So still, I'm all ears. I'm waiting to hear what the great benefit is of doing this when they could easily be treated elsewhere.
All right. Well, that being said, Dr. Carson, we want to talk about what the future holds for Dr. Ben Carson. We've heard a lot of your viewpoints on foreign policy this morning, business in America. There are a lot of supporters out there for you, a lot of Republican support for you to run for president. Will there be a Dr. Ben Carson run for president?
That remains to be seen. You know, I've been meeting with a number of people. Recognizing that in the multitude of counselors is safety, as it says in the book of Proverbs. And we have put together a PAC, the USA First PAC, to explore all the possibilities, but also to support candidates that we need to win in the fall. Because right now, you know, Washington is paralyzed. You know, we have a Senate Majority Leader who has over 300 bills that have been passed by the House just sitting on his desk, basically a pocket veto. As long as we have those kinds of situations going on, we're not going to make progress as a nation. So, you know, I'm concerned about that, and I want to move the argument toward logic and common sense.
Right.
I refuse to get into the mud pit and sling, you know, derogatory terms and things that other people do. I just don't think that that's productive. We've got too many problems,
Dr. Carson,
and we need to solve them.
Well, while the Democrats and the Republicans struggle to find what their message is going to be this fall, I would ask you, what would you run on? Would it be the economy? Would it be foreign policy? What would be your key message if you were to run for president?
If I was running, I would run on the message that we are one nation under God, indivisible, with liberty and justice for all. And what that means, we need to have values and principles. We need to know who we are, and we need to work together. And we need to stop allowing those factions to drive wedges into every crack to create a war on everything. A war on women, age wars, income wars, race wars, religious wars, all of this designed for nefarious objectives.
Dr. Carson, we loved hearing from you this morning. Thank you for all things foreign policy, all things breaking news this morning. We loved having you.